Earlobe piercing is a practice that dates back to ancient times. As a result of the current cultural and fashion trends, we see many individuals who have complications from ear piercing. This can include a dermatitis, infection, keloid formation, and a downward split of the earlobe. In our practice, it's not uncommon to have requests for aesthetic repair of the earlobe. A sudden pull is all that's needed. Torn earlobes are also referred to as split or cleft earlobes. A split can occur from a sudden pull on an earring. Prolonged traction from heavy or pendulous earrings, chronic and repetitive tension and pulling on the piercing site from jogging activities and manipulation all result in a weakening of the piercing site and eventual sagging or splitting. Sometimes the earlobe split can be complete and sometimes partial, creating an elongated hole. A complete or partial cleft tends to be associated with the prolonged use of heavy pendulous earrings. There are numerous techniques for repairing torn earlobes. These must be individualized in order to achieve the best and longest lasting result. These repair methods range from simple excision with primary closure to the elaborate incorporation of a Z-plasty design or notch and groove pattern at the lower border. A straight line repair is simple and fast, but the eventual healing result may be an aesthetically unacceptable appearance with a notch in the earlobe rim. This can occur as the scar contracts over time. The notch can make it obvious that a surgical repair had been performed. For this reason, we generally recommend using some method to break up the straight line closure with a technique called a Z-plasty or notch and groove pattern at the rim. The ear can usually be re-pierced in about 6 weeks following the repair. There is not one operation that fits all situations. In general, we recommend that a partial cleft or a near complete split be converted to a complete cleft prior to definitive repair. This ensures a successful aesthetic closure and optimizes the result. The surgical procedure itself is performed generally under local anesthesia. The ear split is initially excised and the edges are gently undermined. Next, either an inferior Z-plasty or notch and groove pattern is done. The area is usually dressed with an antibiotic ointment. The sutures can usually be removed in 6 to 7 days following the surgery. Pain after the procedure is minimal. Simple care is all that is needed with gentle washing of the area after 24 hours. It is prudent to avoid wearing heavy earrings after the ear is re-pierced. The repair of the torn earlobe as a precise operation requires technical precision and appropriate planning of the incisions and flap designs. A carefully planned and executed surgical procedure will lead to an aesthetically satisfying result. It's important to resist wearing anything but light ear wings immediately after the piercing to give the area a chance to heal so that the repair will be successful. If you have any further questions about earlobe repair, let us know.